This is Jeremy with Chiral Clarity, and in this video we're going to be going over the mediastinum, its divisions, as well as the structures found within each respective division. The mediastinum is the central portion of the thoracic cavity, and it exists between the both pleural sacs, the left and right pleural sacs, and therefore it's between the left and right lungs. The mediastinum is divided into a superior and inferior portion, and the inferior portion is then subdivided into a posterior, anterior, and middle subdivision. The superior mediastinum houses various structures. The main ones to note are the aortic arch and its three branches, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery, the brachiocephalic veins, both left and right, as well as what they form, the superior vena cava, specifically the upper portion of the superior vena cava is what's found in the superior mediastinum. The trachea is completely housed within the superior mediastinum, and that's because the superior mediastinum exists from the thoracic inlet to the sternal angle. And the sternal angle, also known as the angle of Louis or the manubriosternal junction, is the point in which the trachea bifurcates. And that bifurcation point is called crina, and that's where trachea bifurcates into the left and right main bronchi. Therefore, the trachea is housed within the superior mediastinum only. Also, we have the upper esophagus as well as some of the middle esophagus, because if we remember, the esophagus is divided into an upper, middle, and lower portion. The upper portion is completely within the superior mediastinum, whereas the middle portion is mixed. It's between both the superior mediastinum as well as the posterior inferior mediastinum, where the lower esophagus only exists. So the upper esophagus is in the superior mediastinum, whereas the middle esophagus is in the superior mediastinum, as well as the posterior inferior mediastinum with the lower esophagus. We also find parts of cranial nerve 10 or vagus in the superior mediastinum, as well as parts of the phrenic nerves. And since we find parts of the phrenic nerves here, we also find parts of the pericardiophrenic vessels, the pericardiophrenic artery and vein, in which the artery comes off the internal thoracic or internal mammary artery. We also find the left recurrent laryngeal nerve in the superior mediastinum, given that we find the aortic arch here and the left recurrent laryngeal nerve wraps around the aortic arch. We find the sympathetic trunk, and we find parts of the thoracic duct. It's important to note that the sympathetic trunk is the most lateral structure in the mediastinum, and that does not depend on which portion of the mediastinum we are in, but the sympathetic trunk is the most lateral structure in any mediastinum, period.